So with pediatric cases, they are more malleable. So what you will see with a pediatric case is we might do more of like a press and hold to one side, press and hold to another. Hi, it's Dr. Ludeman from Bolingbrook Family Chiropractic. Today I am answering some questions that come up in our Facebook Messenger and Instagram stories. So we got a question from Daniel V, and he said, do you adjust babies the same way that you adjust adults? So the answer is no. Let me grab my little baby right here. So as you can see, babies are a little bit smaller. You're not going to see us doing rotary moves with a baby. We don't do that until kids are closer to like 2 to 4. But again, that is because those kids have to have something like a laterality component that's going to warrant us holding and adjusting like this. So kids are smaller, they're more malleable. Our bones fuse at 25. Men are the last ones to have their bones fused, which is not surprising at all. Women, our bones can ossify sooner because we have more estrogen and progesterone. So sometimes it's around 21 to like 24. So with pediatric cases, they are more malleable. So what you will see with a pediatric case is we might do more of like a press and hold to one side, press and hold to another. You might see us do some like overlapping here where we're pressing and holding. And yes, I understand that I squished the baby's face, but that's not what I do with kids. So we're doing more light pressure with them. We're also going to do more manual adjustments where we're using our thumbs, or you're going to see us using a tool or an activator. Adults, we are sitting in bad positions all the time. We have motor patterns that are already ingrained to our system. We have compensation patterns. And so it takes more force for us to adjust an adult than it does for us to adjust a kid. And that's why treatment plans for kids are different than they are for adults, because I have some kids that I can introduce a new motor pattern. I can show them a rolling pattern and they'll pick it up within 2 visits. But then I have adults that I'm like, here, stretch your hip flexor. And we could be doing that for 2 months. And that's also based on patient compliance. So I find that parents are more compliant with doing treatment for their kids than an adult is, because an adult's not going to just sit and stretch your hip flexor every day because I tell them to. But if a parent is wanting to do some rolling patterns or something like that, they are more likely to do those exercises because they want their kid to hit their milestone. So yes, long answer, we adjust kids differently than we do adults, but there's reasons for that. And that's why you should always look for a pediatric trained chiropractor, someone that's on your ICPA website or someone that's on your ACA website. We see a lot in our area, and I'm sure that it's not just an Illinois thing, but we have a lot of male providers that are like, oh, I got my wife pregnant, or I have kids, so therefore I can see pregnant women and kids. That's not necessarily true. A kid doesn't make you qualified to see pediatrics. You want to make sure that you're seeing someone that actually has a list of credentials, that knows what they're doing, and is putting content out like us to show that they actually have authority in that space.